Okay. We are live.
All right, good afternoon, everybody. Thank you for joining us for the town hall meeting for the Wesleyan Skilled Nursing and Rehabilitation. I certainly want to thank our resident council representative for joining us here today and know that we'll have a number joining us after this recording. And so look forward for you to hear a little bit about what we have to share. But also if there are any questions or comments, please contact our administrator, Laura Kate, with any questions you might have and follow up, and we're happy to do so. If I can, I'd like to ask Georgianne Hewitt, our Vice President for Advancement, to open us in prayer.
I'd be glad to. Please bow your heads. Gracious and loving God, we come to you on this beautiful fall day, and we know that there are a lot of concerns in the world, and we ask that you take those from us. We entrust them to you. We ask that you bless those who are on the front lines of this global pandemic. We pray that you will give them strength and restore them. We know that everyone is working very, very hard to try to protect and safeguard the residents and clients of the Wesleyan. We ask that you bless our residents being separated from family and not getting to be in their normal activities of daily life is very, very difficult. And so please comfort them and remind them always that they are loved. In your son's holy name we pray. Amen.
Amen. Georgianne, thank you for that. I do want to share with you, I had my mask on when we first started, but I've taken it off. I'm in a closed room. I'm probably 30 or 40 feet away from the next teammate, but I appreciate those that are wearing their masks and the continued protection of one another. So what I would say is I have some prepared words that I would like to share, and then leave some time at the end for any questions that we might have. Carly, if you will assist us with that, I'd appreciate it. And then, just again, if there are some additional questions, we're certainly happy to answer them along the way. Georgianne, if there's anything on chat, please let us know and we can respond to that as well. So I will share with you that preparation for this town hall meeting has really not been easy. It's not that we don't have enough content to talk about to fill out the time that we have, but our time together is pretty precious in these moments. We want to make sure that we hit on topics that are very important to this community and to us right now. And I think it's best to kind of get through some of the two most important things that are in front of us. So I'll just kind of jump in right now, the first being the election. And I know that we have residents and teammates and family members that that represent both of the major parties, maybe some that don't identify with either or issues on both sides, and we think that that's great. While we do have a projected winner, it may be some time before some of the issues are resolved for us. But regardless, we're all Americans here. We're all living in this country together. And importantly, for us, we're all together in this community of faith. And so one of the things that I've been so thankful for here at WSN and throughout the different buildings that we have is how much you continue to show love and respect for one another as neighbors. And we like to look at the Wesleyan as a tapestry, something that's made more beautiful by its complexity and diversity and the different individuals that comprise that beautiful gift that we have in that tapestry. So just continue to do what you're doing and respecting one another. We don't have to agree, but we can certainly respect each other. A second topic that maybe is not as easily summarized is COVID-19. And I had shared earlier that I'm reminded of a quote from Mary Poppins that goes like this. Mr. Banks, the father of the household, while talking with Mary Poppins, says, "Would you be good enough to explain all of this?" To which Mary Poppins replies, "First of all, I would like to make one thing clear. I never explain anything." You know, it would be nice if we didn't have to explain all that's going on each and every day. But we do. People want explanations for how the world is proceeding and issues and questions about who caused COVID-19 and how did it spread to the US, and are the reports as severe as they say, and are we decreasing or increasing in occurrences, and thousands of other questions. Well, unfortunately, I don't have the answers to all of those questions, but we do stay connected. As of yesterday afternoon, about 1 p.m., there was reported nearly 1.3 million cases in the United States of COVID-19. Over 1 million of those cases are here in Texas. Over the last couple of weeks, we have gone from approximately, on average, 3,000 new cases a day to almost as high as 12,000 cases a day. Now, aside from those statistics, and probably what's more important to all of us, is that your team at the Wesleyan is involved at the local, state, and federal level to make sure that we are focused on what is our primary and ultimate goal, and that is keeping your entire building, our entire community, all of our teammates and residents safe. Now, without a doubt, it has required sacrifices on behalf of everyone. Certainly our residents, absolutely our family members, and also our teammates. And if given the option, we would have chosen not to have to make those sacrifices, but we have for the good of everyone. And we would characterize us as being mostly successful. Now, external agencies have called us extremely successful. Some have even said that we have been lucky. I would like to add to that list, blessed. I want to underscore that it has been an ongoing effort of our staff to not only up to date on what has taken place, but also their quick implementation, all of the many guidelines and orders that we have received. And we absolutely could not have done it, could not have been as successful as we have been without your cooperation and your support. Your mask use, being aware of and reporting symptoms, reducing the size of gatherings, limitation on visitation, accommodation for our organizations having to curtail the large gatherings that traditionally take place throughout our different programs. We know that this has been difficult. And you can see from the constantly updated website from the Wesleyan, and Georgianne has been instrumental in that, we have had far fewer occurrences in either our resident or teammate population than many of the other communities similar to operation to ours. It does continue to amaze us how other communities allow for continued unrestricted visitation, situations that have resulted in community spread at an at-risk population. This is not something that we are willing to risk and has been a contributing factor in preventing the spread of COVID-19 throughout our community. We are in what researchers have conjectured about a second wave of coronavirus. And what does that mean? Well, we're not exactly sure yet. What we do know is that even though there are a number of differing thoughts on a second wave or resurgence, whatever that might look like, there is one commonality, and that is that human behavior plays a major part. Now, we will continue to communicate what we are doing, make ourselves available for questions, and as we have from the very beginning, remain committed to the health and safety of our entire community in collaboration with you, our residents, our teammates, and our family members. We have been in continual contact with our board leadership throughout this pandemic. I cannot tell you the incredible amount and generosity of time and support that we have received from all of them. Our boards and our committees meetings have not ceased due to the pandemic and have continued like many of our meetings have through either video or phone conferences. But the important part is to stay connected because they want to know how you are doing, our residents, our teammates, how our family members are feeling about all that's taking place. Now, one of the issues that we did discuss with them that we want to share with you is an update about our strategic plan. The first part of our strategic plan has really been completed. Now, that first part is a pre-construction phase, which has to do with different designs. And just to refresh you on what those were, excuse me, is expansion of independent living, expansion of assisted living, expansion even of our WSN, our skilled nursing facility, and other amenities throughout the campus. For that, we have construction documents. They've prepared permits for the city. We have interior and landscape design. And that has come back to a guaranteed maximum price from the general contractor. The design of the project really is everything that we have expected from the quality consultants that we've engaged. Now, that being said, our leadership team really has looked at how COVID-19 and other situations have impacted this project moving forward. So the quality of the design really hasn't been the only factor to consider. We know that during COVID-19, materials have become more scarce. Labor has become more scarce. That's had a significant impact on the costs related to our construction. And that really has led to an exponential increase, one that we feel is not in the best interest of the Wesleyan to engage in right now. Now, we all still feel, the board of directors, as well as the consultants and your leadership team, feel very strongly that these items of expansion are very much in the future of our organization, but now is not the right time. Now, that doesn't mean we're going to stop being strategic. This gives us time to focus a little bit on ourselves, an inward strategic focus, one that continues with the theme that we've talked about for a very long time, which is One Wesleyan. Now, your Wesleyan team has already increased the star rating of this facility from a 1-star that it was when we purchased the building back in December to now a 3-star building. It's an incredible amount of work in a short period of time. Our compliance department and teammates feel very strongly that we are on the track to increase the star rating as well at the next scoring. We're going to be focusing on resident and teammate culture, working on the walking paths as well as increased lighting for all of our buildings, and continuing to be, all of these items had continued to be a part of our strategic plan, but we're using this time to advance maybe some smaller projects, but things that are important to us nonetheless. Now, many of you have commented on what makes the Wesleyan stand out, and that is the people in this community, our residents, our volunteers, donors, and teammates. We want to delve deeper into that culture. We want to find out what's working well, what's not working well, what can we improve upon? How can we continue to connect in new ways, even in light of the times that we are living with some restriction? These focus areas can be in the area of customer service, total wellness, life enrichment and engagement, and of course, clinical acumen. But these are all areas that contribute to our ministry of promoting abundant life. The grounds are something that we can all enjoy, but we do, I know one of the things that Laura, Kate, and Bethany brought to our attention is increased lighting, just to bring some more careful understanding of what our building looks like and safe, and be able to go outside and enjoy all the places that we have. And so we're looking at what that might be for our community. If wishing made it so, I would wish that we would not have to experience this type of incursion on our lives. But we can instead learn to live with it. We can learn to live through it, but continue to think beyond it. Our leadership team has approved, advocated on behalf of our community, and sent it to the Board of Trustees that there will be no private pay rate increases for 2021. Being an organization of benevolence means being benevolent to all of those who are part of this community. We will continue to support the benevolence of all of the residents that are within our organization, but wanted to make sure that we shared that message with you. But please also understand that it doesn't stop just there. Time and again, we hear from you, from our residents, with concerns about the well-being of our teammates. And so I want to share some other news with you. Our leadership team has not only been able to negotiate better, richer health benefits for our teammates, we have also proposed and had it approved by the board that none of the premium increases for healthcare will be passed along to our teammates in 2021. We have also added pre-tax dependent care accounts to assist our teammate parents in providing care for their children while simultaneously reducing the amount of their taxable income. And lastly, teammate increases and bonuses are budgeted for and will continue now and into 2021. Unfortunately, this is not something that can be said by many communities like ours throughout Texas. We are so thankful that God is good all of the time. The cost of COVID-19 has and continues to remain incredibly high, but no more so, and perhaps at times even more so, when it comes to the work and stress and engagement that has been required of our teammates. We ask that you continue to pray for them and support them. As we look at 2021, and as I look at tomorrow, I continue to have hope. Hope that is founded in the incredible gift and the spirit of this community of residents and teammates that I am very fortunate to serve, the support of our Board of Trustees, the generosity of our donors, and absolutely this town of Georgetown that continues to see and value the incredible health and breadth of this ministry. I am thankful that we do have a resident representative here today. Thank you for attending in person. I know, again, that there will be others who will be watching this remotely. But if I could, I'd like to just pause right there, Carly, and ask if there are any questions that I can answer. Or Georgianne, if we have anything in our chat.
Linda, do you have any questions? We would sure like a chapel. A chapel, is what you said.
So the question was, or maybe it was a statement, was the fact that we sure would like a chapel. We could not agree with you more. In fact, as we looked at the expansion of WSN, one of the first things we talked about was a dedicated chapel. And the chapel, absolutely would be for worship services, multi-denominational engagements, but also opportunities to gather teammates and other special events. So really would have a multi-purpose fashion opportunity for us. That is not off of our list. It is a part of our construction project and something we need to consider, but that is not going away. We feel very strongly that, and still that chapel will be at the front of WSN, because we feel like that is a signature about who we are and something we want to make available to all of the residents. So when we are able to get this back on track, and this is a good time to clarify, the board, senior leadership and the board has not made the decision to not move forward with our construction. We've really hit a pause button. And to be very, very clear, we're still continuing to look at the financial market, the construction market, market need, all the different elements that we have to look at to move a construction project forward. That doesn't go away. All it means is that we're just pausing right now to get a breath of where we are in the world. What does COVID-19, that outlook appear to be for us? What changes in the market has the election caused? We just want to take all of these factors and just take a breath. And so I absolutely will express to our strategic planning committee and to the board, and our leaders will know that the chapel is something that's very important, and we couldn't agree more with you.
Thank you.
Absolutely. What else can I answer?
No, not personally, no.
So I will share with you, we did have a couple of comments that had come through by email. One of them is you see a number of different faces in front of you. Laura Kate, if you want to wave, as our administrator of WSN. Laura Kate's been with the family for quite some time, actually, but in a number of different roles and continued growing roles. And we're very thankful to have her and her continued engagement in this organization. Her love and advocacy, not only for the residents, but also for our teammates, is very evident in her work every day. There was a question about who this other person is, Bethany Cisneros, our Chief Operating Officer. Bethany, actually, along with Laura Kate and myself, are one of the handful of licensed administrators that are in the organization. It's important for us to have that kind of bench strength. Especially in these times. And as much as we know that Laura Kate does, as much as we know that Bethany does, we need to have some redundancy in place to make sure that we have continued coverage. So Bethany had been filling in when there was a gap, but as the Chief Operating Officer, she's kind of my second in command, but has a greater engagement in the day-to-day operations of Wesleyan skilled nursing, our assisted living, our independent living, as well as our home and community-based services in home health and hospice. She really just kind of jumps in whenever there's a need to jump in, just as much as our senior leadership does in general. Georgianne, many of the communications you see comes out of Georgianne's office. She's very good. Delise Becker, who's my executive assistant, she's the one who makes me sound good and all the things that I produce. And there are many others. Kelly Getz, our compliance officer, and Jenna Young, our Director of HR, and Kevin Byrne, our Chief Financial Officer, and many, many other people go into just the day-to-day things that are taking place on top of some of the chaos that's going on in kind of our current environment. So I think it's important for us to take the opportunity to introduce these people to you, and we're going to continue to work at that. Carly, maybe that's something through resident council to invite, I think right now, maybe through Zoom or some other environment to have some of our leadership come in so that our residents know who is involved in senior leadership, who is involved in our administration. Some of our family members who have come through WSN, they know and have experienced Eva Carrizales in our independent living, or Donna Home over in our assisted living. And so we want to continue for those relationships to take place. So we want to make sure that we're continuing to introduce who we are to you all. I did receive a question that I'm not sure I want to ask because I can't answer it, but it's, when will COVID-19 be over? If I knew the answer to that, I'd probably be playing the lottery. I don't have an answer to that. What I do know, the answer I have again is very thankful for the teammates that we have, the leadership that we have, continuing to work with the various agencies. My heart, all of our hearts go out to first responders, EMS, the hospital systems, oh my gosh, our schools, the people who are delivering groceries and delivering food, and people from the pharmacies delivering medications, contract therapists, in-house therapists, I mean, really just everybody. Again, cannot say enough about this community, the city of Georgetown that's going to great efforts to make sure that we stay informed, Williamson County in general, and all the resources they're putting into. We know that everybody has met their capacity and gone beyond. Their cup has been filled with this virus, and at times it needs to be replenished, and we hope for that for everybody. We're going to continue to have these town hall meetings. We had one with independent living. We are now having one with you. We will do it with assisted living as well as our teammates, and reinforce that message with everybody. Those are the questions that were sent to me. Are there any other questions or comments? Yes, Georgianne.
Mark, I might, because the Wesleyan Skilled Nursing and Rehab is, at least those that were with Estrella Oaks, are kind of new to our practices around this time of year. I was just going to say the Wesleyan, as a nonprofit, does have a teammate Christmas fund. And we have sent letters, actually some of them have just been mailed early this week, to all the family members of our residents at the Wesleyan Skilled Nursing and Rehab. And those who lived at Scenic are certainly familiar with this fund. It is a way for family members to say thank you to teammates for their work throughout the year, not just at this time of year, but throughout the year. And it's a gift that we give during the Christmas season to all of our frontline workers throughout the whole Wesleyan. And it's a great way to say thank you to those who serve our residents. And it is always received with much gratitude from our teammates. As you all know, when we have somebody that does something nice for us, we can't in our communities have individual gifts be given to recognize someone, but this is a collective way that we can recognize all of our teammates. And so we thank you. If you have any questions about that, don't hesitate to let us know, because we know for some, this is kind of a new practice.
Georgianne, can I also expand on that to say that these gifts go to our frontline staff. They go to our hourly staff. They are the people that you see every day, but there are quite a few people that you don't. We have wonderful nurse aides and med aides and nurses and housekeepers and all, but there are people that you don't see cooking behind the scenes that you might not see, or washing the dishes, or running trash out to the dumpster bin, or taking care of the lawn, or crawling up in the attic and fixing things. The important part is that the support of this, it doesn't go to senior leadership or management and salaried staff. It goes to those frontline and hourly workers, and that's and to celebrate them and the work that they do. And so we do thank you for that. And that has been an ongoing tradition and something that is greatly valued by our teammates. Any other comments or questions? Well, I want to thank you all for taking the time. Again, I just want to say to those of you who are taking out time whether it's later today or some other day here in the future, I know that you'll have the opportunity to view this. We thank you for your engagement. We really do. It does pain us when we know that you can't visit. Many of you have expressed that. We thank you for what you've gone through each and every day through the screening process to visit your loved ones, to communicate with them in very innovative ways. Those of you that we know continue to remain apart. We know that that's tough for our residents and for you. For our teammates who are going through trainings, changes in policy almost every single day, we just ask you to keep all of us in prayer as we go through these challenging times, knowing that we'll come through it. I want to thank you. We want to wish you all the best as you go into this holiday season. And again, if there's anything that we can do, please do not hesitate to reach out to us. Thank you very much and have a wonderful, wonderful week. God bless.